what to do if you get tested positive for COVID-19. Hi, I'm Dr. Nikhil. You may be wanting to manage this at home, and so this is what we're going to talk about today. So the first thing to understand is what is the scenario, what's going on. So maybe you're having a little fever and cough and you go and get yourself tested, and maybe it's like a family member or friend who has a little fever and cough and you just are concerned about yourself. Maybe they tested positive and you go and you get yourself tested. So when you get yourself tested, you have like a day or two wait, and then finally you get that dreaded result and it comes out that it is in fact positive. So what do? Well, first thing is not to freak out and panic. Don't bite your nails or pull your hair out. Just relax and calm down. Most important thing to remember is that we have so many different ways of dealing with COVID-19, and we have many ways to manage it, all even in the hospital care as well. The second thing to remember is that 95 to 99% of people are going to be almost completely fine after getting COVID-19. So there's really not much chance that you're going to face any negative repercussions. Okay? So what do you need to do to take care of yourself? So the first thing to do is to make sure you're socially distancing from people who are not having COVID and the person who is having COVID. So wearing masks, preferably a double mask, surgical mask on the inside followed by a cloth mask tightly, is the first thing to do when you're around them. Second thing to do is to try to isolate the person who has COVID. So if you've got COVID and you're living with your family, move into a place where you are more isolated, just you in the room. Bathroom hopefully is also something that you have just for yourself, right? That is the first thing. The second thing with COVID-19 is to make sure you're taking care of yourself at home. Now, there might be some unpleasant symptoms from COVID-19. If you have a fever, you can take paracetamol. If you've got a body ache, you can again use paracetamol for that. If you've got some throat ache and sore throat, you can try betadine gargles and salt water gargles. Finally, if you have any blocked nose, you can use steam inhalation. And if you are having breathlessness, do use an oximeter. Now, this is where we come to the second part, which is how to make sure that you're doing okay and assess yourself. If you're feeling breathless at any time, to use the oximeter. Now, this oximeter can be used to make sure that you are breathing okay and that your oxygen level is normal. And a normal oxygen level when you're feeling breathless is above 95%. Alright? So if your oxygen level is less than 95%, walk for a few minutes and see whether the oxygen is going up. If it is not going up, it's really important to go to the hospital urgently to see if you're doing okay. So here we have a few reasons why you should or should not go to the hospital. So these are a few basic reasons to decide when to go to a hospital and when not to. So if you have an oxygen level, a percentage oxygen level of less than 95%, rush to the hospital. If you're feeling breathless, really breathless, at rest when you're not moving, even if your oxygen level is showing up, just go to the hospital just in case. The third thing is, if you are having a cough with colored sputum, then to go to a hospital quickly. And finally, if you're having a fever or feeling very tired and delirious, and after having paracetamol your fever is not coming down, then you need to go to hospital urgently. So the last part of people's questions is, how long is COVID-19 going to last? And COVID-19 could last about 14 days, but while the infection only lasts 14 days, the side effects of the COVID-19 can last a lot longer. So after about 14 days of illness and you recover, a lot of people do complain of things like headache, tiredness, sleepiness, body ache, and these effects can last a lot longer. And if those effects are lasting, it's not the initial infection, but it's the side effects of having had COVID-19, and these can last for about months on end, and it's called long COVID. So to remember, the serious issues of COVID last about 14 days when your life is still maybe on the line, and that you need to keep on checking your oxygen. But after those 14 days, you can stop, you can get back to your life, but there may be some consequences of having had COVID, and that can also be experienced as well. Alright?